As a spine surgeon, I oftenly get asked with my patient having lumbar slip disc or canal stenosis, how did I end up here? So, in today's video, we will try to learn how a healthy spine progresses to slip disc or canal stenosis. If you are someone who is suffering from a lumbar spine issue, or you want to learn this to prevent a future problem, this video is for you. Consider your lumbar spine as a flexible suspension bridge in which the core muscles, paraspinal muscles, intervertebral cushion disc acts as a suspension to this bridge, whereas the vertebral body, which are the bone which are stacked one above the other, acts as a bony structure of the bridge. This bridge is connected to each other with the help of facet joints. Also, this bridge has tunnel throughout, which acts as a safe house for the spinal cord and the spinal nerves. The entire spine, along with the lumbar spine, is designed to last long. The aging in the spine also starts in all parts of the spine. The aging of the vertebral body starts with decrease in the calcium mineral content and it marches towards osteopenia. The aging of the facet joint starts with degeneration of the articular cartilage, degeneration of the facet capsule, and it marches towards arthritis. The aging of the intervertebral disc starts with decrease in the water content, decrease in the collagen and jelly content, and it marches towards dehydration and hardening of the disc. Whereas the aging of the paraspinal and core muscles starts with stiffening and losing its strength, and it gets replaced by fat. This process mainly accelerates in late 20s or early 30s. Upon that, poor posture, poor ergonomics, lack of flexibility and stretching exercises creates lumbar spasm and stiffness. This piles up on daily basis, and a point comes where the spasm builds up to an extent where it pulls the lumbar spine behind, and it causes straightening of the lumbar spine, which is called as loss of lumbar lordosis. This creates undue load on the intervertebral disc and the facet joints. Now, the intervertebral disc, which is made up of water, jelly, collagen, starts dehydrating. It loses its height, it becomes dry and hard, and the shell of the intervertebral disc, which is annulus fibrosus, develops a crack. After that, a disc pops out, which is called as slip disc or disc herniation. This slip disc eventually presses on the nerve, causing excruciating traveling pain, which starts from the lumbar spine and radiates down the course along the leg, which is called as sciatica. Majority of the slip disc cases are treated by conservative fashion, that is brief amount of rest, some medications and physical therapy. But in few cases where there is neurological deficit, where the conservative management fails, and there is involvement of bladder and bowel, the surgery is recommended. This degeneration also continues in the patients who doesn't get slip disc. In the later stages of spinal degeneration, it affects the facet joints and the ligamentous complex. The facet joint, which is mainly made up of capsule articular cartilage, starts becoming eroded. The joint fluid decreases and the capsule becomes lax. In the later stages, it gets arthritic, it develops bony spurs, and these bony spurs protrude into the spinal canal, pressing on the spinal nerves. Also, the ligamentous complex, mainly the ligamentum flavum, which is the elastic ligament of the spine, which is responsible for elasticity and spinal flexibility. As the spinal degeneration progresses, these ligaments gets hardened and increase in size, ultimately protruding into the spinal canal and pressing the spinal nerves. This complex together of facetal degeneration and ligamentum flavum hypertrophy, which is protruding into the spinal canal, is called as lumbar canal stenosis. Lumbar canal stenosis presents as leg pain, neurogenic claudication, decrease in standing and walking tolerance, and forward stooping gait. Patient walk with a forward stoop because the spinal canal gets opened up on bending forward and they feel better. Depending upon the severity of symptoms, the treatment is advised. In early stages, this problem can be very well tackled by a conservative management, but in later stages, this might require surgery. Unlike thoracic spine, which is supported with the rib cage, our lumbar spine just has lower back, that is paraspinal muscle, and core muscle, which are abdominal muscle. So it is utmost important we should keep our lower back and the core abdominal muscle flexible and strong to keep our lumbar spine long lasting and healthy.